To imagine that in a country with so many health services that anyone could struggle with finding medications. Yesterday we told you of a possible chemotherapy drug shortage in South Dakota.
And today we're hearing from a member of the Doctors for America FDA Task Force that say there are more medications in short supply here at home. Beth Warden has this First Alert follow-up.
The Doctors for America Task Force is advocating for improvements in the supply chain for medicine. Dr. Ravi Gupta is on the task force. He's also a professor at the Johns Hopkins School of Medicine. He sees two main reasons for a prescription shortage. One is popularity, like Ozempic.
Being marketed heavily, it's been shown to be quite effective, but that's a very specific set of drugs.
The second and more serious concern are the manufacturing facilities, mostly in India and China.
Not being enough manufacturers of ingredients that go into the drugs.
Gupta sees Governor Kristi Noem's action to create a cache of certain medications as a positive move.
Albuterol, epinephrine, insulin, prednisone, and pediatric amoxicillin.
It's not foolproof, however.
A bit tough because you have to know beforehand potentially which drugs might go into shortage, and we don't necessarily know that.
Broadening the FDA's oversight is a possible solution.
The FDA isn't able to closely inspect all of the manufacturing sites. If there's an issue at any one of them, it can create a trickle effect, and then you end up with a drug shortage.
If you're struggling to find your prescription, Gupta suggests contacting as many pharmacies as possible to locate what you need. The second choice is less desirable.
Take a lower dose, or to maybe try to decrease the frequency with which they're taking the drug and hope that they're able to last until a new supply comes into the pharmacy.
Doctors for America is also advocating for the creation of manufacturing facilities in the U.S., increasing transparency, and creating a better way for manufacturers to switch from creating one drug to another that's in short supply. In Sioux Falls, Beth Warden, Dakota News Now.
Now, Gupta adds it is important to discuss any changes in your medications with your doctor.